So good afternoon from London. Good morning to our participants in the United States. It's a pleasure to welcome all of you here at today's Science Café. I hope you are well. In continuation of this year AI Science Café series that we have launched earlier this year in collaboration with the Royal Institutions, we have for obvious reason to alter the format and the topic of our discussions. In response to the unprecedented outbreak of the coronavirus that have severely impacted millions of lives and businesses around the world, various governments have enacted an array of restricted measures to contain the spread of the virus. To a significant extent, these measures are based on three aspects. The first one is the restricting people's mobility. The second is social distancing. And the third is the vast utilization of personal data. Today's presented approach by Tomáš Krajník is targeting the same objective: to mitigate negative impact of the coronavirus, though through a spatial-temporal models which are based on individual responsibility and participation, not on utilization of personal data. This approach is currently gaining a lot of traction and interest from various institutions, and it's promising to be an alternative to present restrictive measures which are, as we know, accompanied with severe detrimental impacts on economies of all scales and many communities and societies. With that, I'm very pleased to introduce to you Tomáš Krajník, a well-acclaimed senior researcher at the Czech Technical University in Prague, specializing in chronorobotics. I shall add that Tomáš and his team have been successful in numerous times in prestigious global robotics competitions such as DARPA or MB0. Just to conclude a technical note on today's presentation, there will be 30 minutes presentation followed by Q&A. You can really ask questions or write them in the chat. This presentation will be recorded and will be made available to you at the Czech Center podcast. So now, without any further ado, I would like to turn the screen to Tomáš Krajník from Prague. Thank you. Tomáš.
So hello everyone. Thank you, FreMEn, for your introduction and for invitation in here. My name is Tom and my background is in mobile robotics, and I will talk today about a system that's actually based on a long-term research for mobile robots that have to coexist with humans in natural environments. And I will show how the algorithms from this domain can actually help people with social distancing. So I'll first talk about the motivation for this research, then about the research itself, and in the end, I will provide you a brief overview and links to the system that we have implemented so that you can use it actually yourself. So let me start with the presentation. So the presentation or the topic of the talk today is FreMEn contra COVID. FreMEn is a very fitting word in this case because the system that we are going to present preserves anonymity of people in its core principle. And also FreMEn actually does stand for frequency map enhancement, which is the core technology that allowed us to implement this system. So let us first start with what we are actually facing and what were the challenges and events that led to the spread of this disease. So let me first start with how all of this actually happened, what I found in literature about the timeline of what we are facing now. So actually, on December 6th, there was a new case of pneumonia detected in China, in Wuhan, and this case was detected in 2 people. One was a guy who visited the market, the so-called vet animal market, and slightly later on, the pneumonia was also detected with his wife, who did not visit the market at the time. So from the very beginning, one could suspect that the virus is actually spreading among people. Approximately 20 days later, the doctors in Wuhan became to notice that there is a cluster of pneumonia cases which were previously unknown. And around December 25, several of the medical staff contracted this pneumonia and they went to quarantine. Later on, a few days, there were many cases that could not really be clearly linked back to the people who directly visited the seafood market in Hunan. So around December 30, Dr. Wenliang informs his colleagues about the fact that this virus can actually spread from person to person, and he urged them to take protective measures. Actually, the Chinese authorities quickly silenced Dr. Wenliang, and they arrested 7 other people whose whereabouts are now unknown. And on that very day, when the authorities intervened, this information leaked to the people in Wuhan. And actually on that day, on the 1st of January, 175,000 people left Wuhan, which actually triggered the epidemics, because there were clearly probably some infected people among this crowd. So on January 3, China actually declared that there is no clear evidence of human-to-human transmission and there are no medical staff infections. And the next day, China actually banned to publication of any information that is related to this new SARS. And they also instructed research institutions to either hand over or to destroy the samples. On January 22, the World Health Organization mission in China actually indicated that there is a clear evidence of human-to-human transmission. So that took approximately 1 or 2 months, right? From the onset of the disease, when there was a clear suspicion that there might be a human-to-human transmission possibility, to actual declaration that there is a strong evidence of that. Okay, so this was something that led to the outbreak of the disease, and one can see that there were actually several characteristics of this. And one of them was that trying to curb the true information about the nature of the disease actually led to slowing down the response. Second, the techniques that were used to confine Dr. Wenliang were actually technologically pretty much the same as the ones that are advertised nowadays by governments to help quarantine or to make the quarantine better. So basically the same technology as would be used for contact tracing was actually used against Dr. Wenliang in order to make sure that he does not spread this information around. Yeah. So that's first of the thing, the beginning of the epidemics. So actually, to assess the danger of the epidemics, what I did is that I also take a look. Many people are saying that this is very similar to influenza, so I actually checked about the numbers of the disease, and I used the data of the Center for Disease Control. It's a US organization. So these are figures that hold for the US. So actually, I checked the last 3 years of influenza epidemics, and what's actually quite interesting is that for me it was surprising how high these numbers are. So in the winter 17 to 18, there was the estimated number of people sick with regular influenza in the US was 43 million. There was around 600,000 people taken to hospitals and around 60,000 deaths. 1 year later, there was another wave, which is of influenza is a regular epidemic that's happening every winter, I would say. There was 35 million people sick, 500,000 people hospitalized, and around 30,000 people dead. And again, the estimated count of the people who are probably sick with influenza this year is again around 50 million, around 1 million people in hospitals and around 80,000 people dead. On the other hand, the COVID-2 disease in the US, so far 1 to 3 million people who are sick, around 40,000 people in hospitals, and around 30,000 dead. So the problem is that we don't know the characteristics of the COVID-2 disease. Many people would say that this is, comparable to influenza, etc. But this is a new disease. We don't know if we are able to build antibodies. What are the long-term impacts of contracting this virus, etc., etc. So although the numbers might look a bit similar, I think we should still be aware that this can be quite much more dangerous than regular influenza. However, what I wanted to show here is that we are facing epidemics, on a regular basis. So when facing the epidemics, one can actually check what are the general techniques, how the World Health Organization is telling us how we should, tackle the pandemics and epidemic cases. And if one checks about the strategy of the WHO, there are basically 5 points. There is, one can see that there is a mobilization to prevent the spread of the disease through personal hygiene habits, like hand washing, respiratory etiquette, and social distancing. Another strategy, or another keystone of the strategy, is to control, to rapidly find and isolate the infected cases, and then to suppress the spread again through prevention, distancing, and travel restriction. Of course, another cornerstone of how to tackle this situation is to, provide a proper care to reduce mortality. And of course, the main thing that everybody is looking now is the pharmaceutical solution. That means developing a vaccine or developing a drug that would be able to cure the COVID. However, with all of these strategies, what we can see here that prevention appears twice. One of the points is the control, then it's contact tracing. That means to find and isolate people who are infected. But the prevention is more or less more emphasized in this strategy. And regarding the pharmaceutical solution, it might take, perhaps more than a year definitely to develop a new vaccine, or we might be lucky and we might find that some other generic drug might work. However, even if this is the case, we might face other pandemics and have this problem again and again. So regarding the strategies, what I also did is that I actually checked like the textbooks about how to tackle epidemics. Then I checked the websites of the health organizations in different countries to see actually how the governments follow the general strategy that's set by the World Health Organization. So in the textbooks that I found, what I did a very simple analysis just to see just to document the narrative of the individual organizations on tackling the epidemic spread. So I took the introduction to epidemiology, and I took all of the words that are in these documents, and I simply counted the frequency of these words appearing throughout the book. And I took the 10 most prevalent words, and I did the same for the individual websites of these of the health organization. So in the introduction to epidemiology, the most frequent word is education. Then what's there? It's contact, prevention, susceptible, patient, interview, washing, advice, person, hand. And you can really clearly see that it's quite much focused at the education and prevention. These are the tools that are, I would say, emphasized in that textbook, in this kind of a textbook. Regarding the Center for Disease Control, that's a US institution. Again, when one would count the frequency of the individual words, it would be people, water, face, cover, cloth, hands, soap, bleach, household, clean. Again, this is quite clearly aimed at the personal hygiene narrative and how to keep your surroundings clean in order to mitigate the risk of getting infected. Similarly, NHS, when one looks at the pages of NHS, you will find the words that are help, NHS, home, advice, risk, health, medical symptoms, stay, information. And again, this is aimed at social distancing and prevention. And I would say that the information provided by both Center for Disease Control and the National Health Service is more about calming the people and really advising them on what to do without any alarmistic messages. I also checked the web page of the Czech Ministry of Health, and the words are as follows. It says contact, that's the most frequent word, contact, quarantine, hygiene officer, app, eRouge, risk, smart, potentially infected, and Maps CZ. So one would wonder why there is eRouge and Maps CZ. And these are actually apps that are now heavily advertised by the government. And these apps are for contact tracing. So the Maps CZ app is actually doing GPS tracing. And when you are found to be infected, the hygiene officer can use your tracking information and it's very euphemistically said, to help you remember when you have met whom, where. So this phrase, helping to remember, it triggers a bit a memory from when I was at a police station some 20 years ago. And also the police officer told me that he will help me to remember where I was using, well, more traditional techniques than a smartphone tracing. Regarding the eRouge application, that's again about the tracing, contact tracing. It's not tied to the GPS. And I have to say that the eRouge is a bit more concerned about the privacy of the users because they don't track GPS. They simply track how long two users of two smartphones have been close to each other, and they measure this by the Bluetooth technology. However, what I wanted to show here is that unlike of the textbook cases or the US and UK institution, our ministry is more aimed at this contact tracing narrative of how to tackle the spread. There is not much mentioned about the actual prevention, and all is now aimed at the so-called smart quarantine system, which is about people tracking. So taking into account all of these strategies and all of these narratives that the individual governments have, one has to think a bit, even if we are able to tackle this spread and to curb the new cases and the number of infected people per day, we have to think what we will have to do in the long term. So the long-term outlook from the literature that I saw and that I could study, it seems that developing a vaccine might really take quite some time. If one has a look on how other epidemics which don't have a pharmaceutical solution yet were actually tackled, one can find, for example, the case of HIV. So in the beginning, when HIV was spreading, there was a lot of misinformation, and there was a strong push by several governments to try to isolate the groups that were in their eyes responsible for spreading the disease. And then there was a lot of stigmatization of the people who contracted HIV. However, in the long term, the countries that promoted responsible behavior, and they basically educated people in a fair way by telling them, look, these are the risk behaviors, don't do this, or think about what you're doing. These are the protective measures that you can take. And these strategies, they were much more long-term, and it was a long run. But in the end, these strategies were behind tackling the spread of HIV. Of course, I understand that contracting HIV, you need much more intense contact with the other person. But the similarity between the COVID and the HIV is in the fact that the latent and incubation periods are quite long. And because of this, contact tracing itself is not as efficient, because what you need to do is to reduce the number that you infect during this latent period before you actually develop your symptoms, if you develop them at all. So from the long-term perspective, one needs to have sustainable social distancing. However, social distancing is not easy to implement and maintain in the long term again, because people are, after all, we are social creatures. We want to meet with the others, and all the society has its networks of food distribution and education, etc. And to put everyone in isolation would basically cause economic collapse. And an economic collapse would mean that the health systems would collapse, and this might eventually bring much more deaths and much more reduction of the life expectancy than the virus itself. So one has to implement social distancing in a way that's, I would say, in balance of the economic needs and the needs of the quality of life. So there has to be a balance between several ways. Social distancing cannot mean really, isolation. Another problem is that if the social distancing measures are lifted, or perhaps people become less careful, we will probably have secondary outbreaks. And these secondary outbreaks actually can be much stronger than the outbreaks that we are facing now. So according to the models that I have seen, one can predict that there would be a secondary outbreak, for example, in Japan, early May or maybe 1 week earlier. So we can see that how lifting these social distancing measures can really lead to secondary outbreaks. But I'm trying to forecast here. The future will show. We will see in a few weeks. So what we are actually proposing here is that from the literature, it seems that most of the infected cases don't come from like these binary contacts. So this is the typical, this is how people typically imagine that one gets infected, is that you go someone and someone, coughs somewhere, and you pass through the aerosol, and you breathe in the virus, and then you are infected. However, in most of the studies, it seems that these contracting this virus through a random binary contact is not often. It seems to be a marginal case actually, and most of the infected people can be traced back to sort of clusters of infection, and these clusters are basically locations and times of large concentrations of people. So these are religious gatherings, these are conferences, then large supermarkets during the peak hours, etc. So when we were actually thinking what could be one of the most efficient way how to tackle the epidemic from a longer term perspective, then one should really aim at allowing to and facilitating long-term sustainable social distancing. And that basically means, from the literature that we have read, it means that you need to have a solution that would allow you to efficiently avoid clusters of infection. So avoid locations and times where there are large densities of people. And basically, also what you want to achieve is that typically when you go out or when you want to socialize with people that you already know. You simply don't want to meet people that you don't know. So you can have you don't want to go to these crowded places because of socializing. It's when you want to socialize, you would go to meet your friends, not to a a random place with a lot of other people. So our system is actually aiming towards recommendations to people on how to avoid these clusters of infection. So how does actually robotic technology fits into this narrative? So what we were studying for the last 10 years, say, were robots that were supposed to operate for long time in natural environments and in environments that are shared with humans. And one of the problems that the robots have is that if you place a robot somewhere and you want the robot to operate in the new environment, you place it there, you take a joystick or whatever, and you guide the robot around, and the robot creates something that's called a map. And this map that allows the robot to determine where it is, where it's its charging station, where are the areas the robot is supposed to operate at. So the map tells the robot where it is, and also the map is used by the robot to plan its path around and to plan its activities. One of the problems of these maps is that after a certain time, any map becomes obsolete. So outdoors, simply if you have a map that's built from your camera and the sun sets down and you have night, everything looks completely differently. And for robots, this is very, very tricky situation because they cannot really compare what they are seeing, and they cannot relate a night scene of a same location to how the location looks during the day. So they become confused and they cannot determine their position. Indoors, the problem is similar because people they tend to open and close doors, they tend to move furniture around, and this causes any maps that the robots are using to deteriorate over time, which is a negative impact on their ability to operate. So what we have been researching were methods that would allow to describe not only the environment structure, so how stuff looks like, but we were developing methods that are trying to describe the evolution of the environment over time. So say that a robot is moving in an indoor environment, and after some time it will understand what are the changes that it sees, and because all of these changes are caused by people, and people have habits, one can try to learn about the patterns of the habits and use these learned patterns to predict what are the changes in the environment. And we did a very nice algorithm that's a probabilistic algorithm, which is called a frequency map enhancement. And this algorithm allows to take almost any map in robotics, and by tweaking the representation of the underlying probability, you can turn this map that was originally static into a map that actually describes the evolution of the environment over time. And in one of our research, we actually employed this algorithm in a hospital in Vienna. And in Vienna, what the robot had to do is to provide useful information to the hospital clients. And for that, the robot actually needed to forecast where the people are going to be at what time. So say the robot was supposed to remind people that there is some special event, and therefore the robot would go somewhere and display information on its screen about this event, and it would expect that people would try to search more information. So the robot was trying to infer from its observations where the people will be at a certain time, and to go there in advance and to display this information. And we actually tested this algorithm in this hospital in Vienna for several weeks. And after a relatively short time and from quite sparse data, so typically we had something like 20 measurements per location on the people density or on the people's willingness to interact with the robot. And from these quite a few data points, we were able to build temporal models that really allowed the robot to make long-term forecasts of when it's more likely that the people will be actually around that area. So the robot found some obvious things. So for example, the crowds of people are happening around the lifts, because you go to a lift and you press a button and then you have to wait, and in the meantime other people can accumulate. And other clusters that were not as spread over time were, for example, around the hospital's cafeteria and also around the freezer and at the offices. But around the cafeteria, as one can imagine, there are these more busy times when people are going for lunch. The same holds with freezer. So the robot had to learn, and it actually did learn, and inferred what are the busy times around these locations. So when we were thinking on how to contribute with robotics technology to the spread of to curbing the spread of the disease, we thought that maybe instead of using the physical robots, one could use this algorithm that allows to learn from a small amount of irregular observations to learn what is the likelihood of occurrence of human crowds. So we basically took this algorithm that we have been developing since 2014, and we created another system that allows to feed information not only just from that hospital, but that allows the people themselves feed information in this system, and then to see what are the predictions. So in principle, the system works by the system composes of two mobile apps and a processing server. So in principle, you can install a mobile app that allows you to report the density and the number of people at a certain location. And imagine that you are going to a shop and you just left the shop, so you have a good GPS reception, and you knew that you had to wait for a long time in a queue. So what you basically say is that you tell to this app, okay, I've been to this shop and there was 100 people around and it was really, really crowded. So you enter this situation, this data into your application, and you click send. And at the moment you click send, what happens is that the app reads your GPS coordinates and the data that you entered, and it sends this to a remote server. Nothing else is sent. Because the algorithm that I was talking about actually describes only the locations and the time evolution of the certain phenomena, in this case, the density of people at certain locations. So we actually cannot work with people tracks. So instead of tracking someone all the time, we only require, let's say, active assistance of the person when he or she wants to report about the density. So actually, let's say that you typically visit, I don't know, 3 different places during the day, and you simply send actively from these places information about the density of the people around. So what happens is that this is sent to processing servers, which create something that's called a spatial-temporal map. So a spatial-temporal map, as I was explaining before, is a map that captures the evolution of certain phenomena over time. So in this case, we take all of these measurements, we take measurements from similar places, and we are trying to infer what is the typical density of people at the location. And through the processing, we are also creating a forecast for the next day. So our models not only capture the history, but they perform these forecasts. So once these maps are created, once these forecasts are created, they can be actually distributed to the public, either via a simple web page where you open a map, you check the shops or parks or playgrounds in your vicinity, and you click on them, and you can see what's the forecasted density of people, or what's the forecasted crowdedness of these locations over time. Also, this information is transmitted via a web application, which works in a similar way. So basically what you do is that when you first install this application, you pick a few places where you go frequently, and the application will recommend you the times of the visit of that location. So what actually happens is that the app says, okay, I want the prediction of the crowdedness of this particular place, and this gets downloaded from the server, and then the algorithm calculates times when it's not so much crowded. It does some randomization, so people would not come in the exactly same time to the place, and then it makes you a time recommendation. So naturally, this recommendation will be in some uncomfortable time, because people don't visit these shops. For example, they don't go shopping when it's uncomfortable for them. However, what you can say is that, okay, you see that the time basically doesn't fit you, so you just click on the shop or on the location, and what you see is this timeline that shows you, okay, it's really crowded around 4 o'clock, and it's much less crowded if you go 2 hours later. But you don't have to go at 8 because there is no one. But if you already go at 6 o'clock, the risk will be quite low. So this is the idea of our system. And actually, we released the system a few days ago. So you can simply go to the web page and you can download both of the apps. So what's the difference of our system to all of the other ones? So I think that the principal difference of our system is that we do not track people at all. So the algorithm that the system is based on is only able to describe locations. So basically what it does is that if there are several people visiting a certain place in different times of the day, all of these informations get aggregated about this particular location. And let's say after you have 10 to 20 measurements, you get quite a decent temporal model that someone else can use. Another advantage of our system that it works very locally. So you don't need to have 10% or 50% of population using this app. From the experiments that we have performed, it seems that in the city, for example, where I live, it's a small suburb of Prague. There is around 15,000 people. You need less than five users of the reporting application to create a quite good spatial-temporal map of most of the significant locations in the city. So 5 people can map a town that has more than 10,000 population. So we don't need to have that many users. Another advantage of the system is that it's actually divided into 2 applications. One is for the reporting, and by reporting, you are actually helping the others. You are not really helping of course you are helping yourself mainly, but you are helping the users of the second app that does the recommendation of the times. And the users of the second app, again, you don't need to have many of them, but from what I have observed and from what I've understood, there are plenty of people who are somehow more in danger by the spread of the virus, and of course also by regular influenza. For example, they have some chronic illness, or perhaps there is someone in their household who is elderly, or who also has some chronic illness. So these people, they are very concerned about their own health, and they are also concerned about the health of the people that share households with them. So they can very easily use this app to avoid crowded times. So this is why we designed the system in a bit different way than the others. So we actually have an app for people who want to help others, and we have an app for people who want to protect themselves. And in the middle between this app, there is our engine that actually runs these forecasting algorithms. So that's probably all what I wanted to present about the system today. And yeah, thank you for your attention.
Thank you, Tomáš. It's been quite interesting and inspirational presentations how to tackle the spread of the coronavirus with the emphasis of the personal responsibility and our participation. So I like to thank all of you who have been able to join us this evening. And once again, thanks to Prague, to Tomáš Krajník from the Czech Technical University. And have a good evening.